This is the proximal radial ulnar joint right here, and this is the distal radial ulnar joint. The proximal radial ulnar joint is formed by the head of the radius bone articulating with the radial notch of the ulna. The distal radial ulnar joint is formed by the head of the ulnar bone articulating with the ulnar notch of the radius. And if the head of the ulna is right here making up the distal radial ulnar joint, you can easily remember that the head of the ulna is in the distal end of the ulna. And the ulna bone, together with the metacarpal bones, which are the bones that make up the palms of our hands, and their corresponding bones in our feet, which are called metatarsal bones, plus the phalanges, which are the bones that make up our fingers and thumb, and also make up our toes, are the only bones in our body that have the head in the distal end. All the other bones in our body have the head in the proximal end. So that's something very particular about metacarpals, metatarsals, phalanges, and the ulna bones. We also see in this image the little bumps on the lateral and medial aspect of our wrist, which are the styloid process of the radius bone and the styloid process of the ulna bone. Now pay attention that every time our forearm is pronated, the radius bone is anterior to the ulna bone. And this only happens because of the proximal and distal radial ulnar joints.